Hello, everyone, and welcome to the Anti-Doping Podcast, brought to you by the Partnership for Clean Competition. I'm your host, Dr. Marie McNeely, and today we are joined by our guest, Andrea Lindsey. Listeners, Andrea is Director of Operation Supplement Safety, the Department of Defense Program of Record for Dietary Supplements, a program of the Consortium for Health and Military Performance of Uniformed Services University. She is also an assistant professor at the Uniformed Services University. And today we are going to talk more about Andrea's career, her work on Operation Supplement Safety, and the recent Performance Enhancing Substances Summit, which was a collaborative event centered around anti-doping in sport and the military. So, Andrea, welcome to our show today. How are you?
I'm doing great. How are you doing today?
I'm doing quite well, and I'm excited to learn more about you and the work that you do today.
Well, I want to thank you for inviting me to talk to you all about Operation Supplement Safety and dietary supplements. First, I'd like to read my disclaimer. As of today, July 8th, 2024, I am a Henry M. Jackson Foundation employee, and these are my opinions, and the assertions expressed herein are my own and do not reflect the official policy or position of the Uniformed Services University or the Department of Defense. What I'll be discussing in this podcast does not necessarily reflect the views, opinions, or policies of the Henry M. Jackson Foundation for the Advancement of Military Medicine. Any mention of trade names, commercial products, or organizations does not imply endorsement by the U.S. government. I have no financial interests or relationships to disclose. That is my disclaimer.
Well, now that we've got that disclaimer out of the way, I think that's very important to mention. We're excited to chat more about you and the work that you do. I want to hear maybe a little bit more about your backstory. So, Andrea, can you tell us, how did you first get interested in this area of supplement safety, and what was the path that you took to get to your current position?
I won't date myself that much. As a matter of fact, I didn't start my career as a nutritionist. I actually started my career in politics, but that's quite a story. And so actually, before I came to the Consortium for Health and Military Performance back in the summer of 2010, so boy, I can't even believe that's 14 years ago, I worked on a collaborative project with the Food and Nutrition Information Center at the U.S. Department of Agriculture and the Office of Dietary Supplements at NIH. And that collaborative project was an ingredient database about dietary supplement ingredients. And I really had never worked in this area prior to that. I started my career as a nutritionist, as a WIC nutritionist. So that just opened my eyes completely to this topic. And then when I came to CHAMP back in 2010, Operation Supplement Safety did not exist. Of course, we knew about issues, but we did not have an established program. So we were fortunate to be able to build this program of record. And here we are now with a Department of Defense instruction, which we can talk about. So I became more and more interested and educated myself. And I always feel that I'm in the space of learning, because with this particular topic, I always say it's a very layered topic. And there's not many of us educating in this space. And to be a subject matter expert in this space, I think it takes quite a bit of time, because there's so many facets of it. So I find it fascinating, but I also am so engaged in it because there's so much work to do.
Oh, absolutely. And can you tell us what it's been like for you then, being in this role of the Director of Operation Supplement Safety and really seeing that program built from the ground up?
Well, I have to say that it's been quite gratifying and a lot of hard work. And of course, I don't do it alone and haven't done it alone, but there was a need. And we can get into the specifics of that as we talk. But again, as I reflect on those 14 years when I was hired at CHAMP, we did not have a team to work on this effort. And now we have an Operation Supplement Safety team. And it's such an important topic to make sure our service members stay safe from either an adverse health event or a positive drug test. And the education is so important. So to see where we are now from that starting point, from having no program, and also to know how much more we have to do. So we're happy with our success thus far, but we definitely have more work to do.
Definitely. And it sounds like there wasn't much structure until relatively recently, but do you know what some of the efforts have been historically just to manage the use of supplements and performance-enhancing substances within the U.S. military?
I certainly can't speak fully prior to joining in 2010, and there were other efforts, I know, to develop policy and collect adverse events associated with dietary supplement use, for example. And there were some papers published related to performance-enhancing substance use in the military. So when I speak of that policy, there were efforts prior to me helping to develop this program. We have our Department of Defense instruction that was issued in March of 2022, 6130.06, use of dietary supplements in the DoD. That's a really big deal. But that effort had been tried many years before, and it wasn't successful. But what that tells us is that they knew there were issues. They knew that something needed to be done in terms of mandating that education and having a specific program to really work with the entire community. That's not just our service members. That's all of the providers, leaders, all the allied health professionals, and certainly veterans and family members.
So, Andrea, you mentioned that Operation Supplement Safety is relatively new, started in 2010. How did it originally come about, and how did you sort of make that shift to having more structure around supplement safety?
Well, back in 2010, 2011, there were many, many adverse events and several deaths associated with the use of a few products that contained the synthetic ingredient DMAA. And that's a synthetic stimulant similar to amphetamine, but the manufacturers of those products were claiming it was a natural ingredient. So all of those adverse events and several deaths we never want to see in the military. And at the time, the Assistant Secretary of Defense for Health Affairs requested in 2012 a DoD-wide educational campaign on the safe use of dietary supplements. So that's how we really came about. And now we're a mandated program 10 plus years later. And unfortunately, we still have some of the same issues and have seen the emergence of even some other problematic products and ingredients.
Certainly. And I think the recognition that this topic, this area of supplement safety is a need and a priority is a critical step. So let's talk a little bit more about Operation Supplement Safety and what are some of the resources and maybe educational initiatives that this program has really focused on over the years.
Well, our focus really is the informed use. I always say our mission was the informed use of dietary supplements. And now we've expanded that to the informed use of all health, wellness, and performance products, because what we're seeing in the landscape today is very different. And our efforts on the website and what we do in social media and going out to bases, presenting at conferences, doing this podcast is that evidence-based information. Very few of us are out there taking the information, translating it for the consumer. In our case, that's the service member, and then pushing that out in different forms. The website is one form, social media is another, and as I mentioned, out in the community. We have many ways in which we have developed products. We have our scorecard, which is our algorithm that we developed many years ago, which is an easy 7-question scorecard that we call it to assess the relative safety of a product to mitigate risks. We have evidence-based articles. We have other information on the website to assist, again, whether you're a provider or an allied health professional or a service member.
I love that. And I think being part of these education and dissemination efforts is really exciting and perhaps really rewarding. How have they been received by members of the military?
I have to say it's challenging because we have this instruction, 6130.06, use of dietary supplements in the DoD. And that says that we are the program of record and that we must maintain the official DoD prohibited dietary supplement ingredient list on the website and provide educational training on dietary supplements. That is not only to the service member, but to all providers and allied health professionals. So we have that policy, yet it's challenging to then really execute it and execute it broadly because we always want to meet
The service member where they are.
So I think a really important component of that is to work with those folks on the bases that are actually then working with the service members. Now, we're talking about not only the Army, Air Force, Navy, Marines. We have Coast Guard, which of course falls under Homeland Security. We have Space Force. I hope I haven't missed anyone. So not all of them have, for example, dietitians on bases. Maybe they have health promotion folks. And so we have to rely on those allied health professionals to educate them and give them all the resources that they need, and they can then work with the service members. So that train the trainer has evolved into one of our biggest initiatives, I would say, in the last couple of years. And I've been really fortunate to work with the Army H2F program, for example, where they schedule a week at an Army base and they schedule a couple of really big presentations and then some individual meetings with some allied health professionals. And they just bring me in, and those relationships, it's not one and done. It is the beginning of an ongoing collaboration to what do you need? Okay, you need a poster on SARMs. We developed a poster with dietitians at Fort Drum in New York while I was sitting in a room with them. That's the type of work that we need to do and are doing.
Well, I love that you emphasize these collaborations. I think they are tremendously important in these kinds of efforts. And I know that Uniformed Services University's Consortium for Health and Military Performance, or CHAMP as we call it, and Operation Supplement Safety teamed up with Major League Baseball to host the inaugural Performance Enhancing Substances Summit. This was back in May. So Andrea, can you tell us more about why this particular collaborative summit was held and who attended the event?
I still haven't really recovered from that wonderful event. Mm-hmm. Our collaborations allow us to draw attention to the areas that need it. And we have to raise awareness of issues surrounding prohibited substance use. We have to bring it forward, all of these emerging substances that contribute to this public health issue, which affects not only service members, but athletes and all consumers. And we need all of them to remain safe and well to perform at their best. So, of course, we partnered up with Major League Baseball, and also in attendance was United States Anti-Doping Agency, Department of Justice, representatives from the Food and Drug Administration, other professional and collegiate athlete organizations and athletes, healthcare providers and allied health professionals, and specific members of the armed forces. So it really was, even as I looked out onto that audience and saw people in uniform amongst also athletes, it was very gratifying to be able to bring such a wonderful cross-section of people together.
Absolutely. And I've heard wonderful feedback about the event. But for you personally, what did you enjoy most, Andrea, about the summit? And were there particular key takeaways that you've brought back from it?
Well, for me, the most enjoyable part was the collaboration. I can't say enough about Major League Baseball. They do such incredible work in their educational efforts. And they were just, I keep saying wonderful, but it was just so easy. I hate to minimize it, to work with them on such a big event. And to just be able to gather and have productive, informative discussions about similar issues that we share and that we may learn from each other as we each face unique challenges. But then how can we come together, raise this issue, because it is for sure a public health issue, and shed light on the parallels between PES use in the military and in sports. And then how are we going to work together and come up with effective solutions.
Oh, I love that. And do you have an example of maybe something that you learned or something that you heard or took away from one of these conversations that surprised you?
I'm not sure it was actually surprising, but confirming. When I listened to the presentations of United States Anti-Doping Agency, of course, we've partnered up with them in the past, but to just confirm some of the things that they're hearing, and also even the providers that we had on the panel, why are they engaged in this topic? And why do they need to be at the table? And also just confirming the need to educate on products that are third-party certified. And of course, MLB and USADA educate on NSF certified for sport. We educate on several that we have, quote, vetted, and even just hearing about that topic because we had a panel just on the third-party certification of products.
Oh, that makes sense. And I know MLB is a founding member of the PCC, so the PCC has enjoyed working with them as well. But how did this collaboration between Operation Supplement Safety and Major League Baseball come about? And what have been some of the benefits, Andrea, that have really emerged from this particular collaboration?
Well, back in 2019, we collaborated with Major League Baseball on a consensus statement on the importance of third-party certification for dietary supplements. We co-authored a paper with them along with USADA and UFC. And that paper, we talked about it at the PES Summit on May 1st. We all referenced that consensus statement in our individual work. And in the military, the DoD Office of Drug Demand Reduction, they do all of drug testing for the entire military, funded us last year to educate broadly and across social media on performance-enhancing substances with a positive anti-drug campaign. So when they reached out to us with that additional funding, because they fund us to educate, I wrote to Major League Baseball and said, would you re-engage with us? Because I think it would be very beneficial to join forces in this space. And they agreed. And then we came up with a concept of the summit. And boy, it seemed like it was so far ahead. And then all of a sudden it was May 1st and there it was. And it was just incredibly successful. And coming off of that summit, we are now working with Major League Baseball and USADA in a collaboration to form a consortium.
Oh, that's wonderful. And I think you highlighted that there are these parallels between the challenges that you might face or the issues that you have to think about when talking about sport, but also talking about the military. So what similarities are you seeing in the military anti-doping system compared to the sports anti-doping system? And how can both of these different systems work together and build on those similarities?
Well, I always say that service members are the elite athletes. So similar to professional athletes and collegiate athletes, they're always trying to optimize performance in all ways. And so we see similarities in what types of products and ingredients they may seek, and education is key in this space. So that's how we draw those parallels. We know USADA does great work in their educational efforts about anti-doping, as does MLB and some other professional sports leagues. And then we have our educational program ops so that we in our community can speak to our audience. And so we all can share lessons learned and what is out there as risks across the board, and then develop those effective strategies to take that education even broader. That might be in the form of an awareness campaign, for example. It might be some research, or it might be this consortium and a position paper, or all of the above. And that's exactly what we're planning on doing coming off of that summit.
Oh, that makes sense. And I think many of our listeners out there may be familiar with sort of how the system works in anti-doping, and particularly the WADA prohibited list from the World Anti-Doping Agency. And earlier in our conversation, you mentioned the DoD Department of Defense's prohibited list. How do these differ, or are they similar?
Well, certainly we know that some service members are also athletes. And so our Department of Defense instruction, that DoD, again, has it outlined. How does something land on the DoD prohibited dietary supplement ingredient list? And that sort of is a long list, but basically it's S0 through S5 of the World Anti-Doping Agency prohibited list. select substances on S6. Anything that's an unapproved drug, by definition, does not belong in a dietary supplement. So that lands on the prohibited list. Anything that we find from testing that has not been on a label, for example, that's a drug, that goes on the list. We have a whole criteria for our prohibited list. We have an ops advisory board so that if anything is added outside of that criteria, it has to be voted on by that advisory board. So there are certainly many parallels, and we work very closely with our federal partner at Food and Drug Administration. If we can't determine an ingredient, for example, is a legitimate dietary ingredient, and we see it on a product label, we go to them and ask.
Oh, that makes sense. And are there systems or mechanisms by which members of the military can pose questions? I know with the anti-doping system, there's resources like Global DRO, for example, or sort of those kinds of places where people can go to find information specifically about a particular question that they have.
Yes, we have our Ask the Expert portal on the Operation Supplement Safety website at OPSS or ops.org. Right now, we are averaging about 135 questions per month. So some questions that are asked, and these may come in from not only service members, but providers or leaders or judge advocates. And some that are asked from our active duty military may involve a product or an ingredient. They say, I want to take X. Is X safe? And am I going to pop positive? So we have a whole system that we've developed, how we approach and answer. And we tell them that we can only answer the question based on what we find from the label alone. And from the label alone, we point out any risks that we see. That may be a prohibited ingredient that we can identify on the label, or an ingredient that can affect maybe their health. And what do I mean by that? Well, some of these, quote, high-risk products, we've got some high-risk categories. What are those? Bodybuilding / pre-workout, sexual enhancement, and weight loss. So if we have a high-risk product and we can tell, even if it has multiple stimulants, if you've got a product with caffeine at 400 milligrams and several stimulants that we can identify, that's something that we're going to point out because we want our service members to be well and ready to serve. And if they are taking several products with several stimulants, we don't know if that's safe. We can't answer that question. That's some of our talk track when we do our train the trainer, when we do presentations on bases, is you can't be just concerned with what is prohibited. What could maybe impair performance rather than enhance performance? And so let's help you identify those products that may be able to help rather than impair.
That makes sense. And Andrea, are there any other aspects of this Operation Supplement Safety that you'd like to highlight?
Oh, many. I don't know if we have the time. We're doing so much work. We're creating an ingredient database in the background, and that ingredient database supports the prohibited list that's on the website, but also supports an app that we're developing. So we're developing an app, and that app is called OPSUP. Everything in the military has an acronym, and that we hope will go out into the marketplace in 2025. So we really paused our work on the app to work on the ingredient database because the ingredients are now in a portal rather than an Excel spreadsheet. And we convened an expert panel to guide us in the criteria for the color categories of those ingredients. And what we landed on were green, yellow, red. We have effectively tagged the red ingredients. That's easy. Green or yellow may seem easy. It's really not. That's important because that app, when a service member or any consumer scans their product, and if the barcode isn't there, they can type in the UPC or they can scan their ingredients. Is it going to get flagged? Will it get flagged with a red ingredient? Is it a World Anti-Doping Agency prohibited ingredient? Is it a DOD prohibited ingredient? Is there any concerns, that multiple stimulant concern? So that's, to me, really such important work that we're doing. We're also developing a health professional module The DoD requires us to do that. And that will be in a platform that is DoD wide. And again, we pause that to really work on that ingredient database. So that's just a few of some other projects that we're working on.
Well, I think those sound really exciting and much needed as well. And we talked about kind of how these two worlds of anti-doping and military can work together. How does the Operation Supplement Safety currently collaborate or interact with other stakeholders that may be relevant in the anti-doping or supplement safety community, such as the Partnership for Clean Competition or others?
It is such a huge, impactful part of our work. You mentioned Partnership for Clean Competition. USADA, we've partnered up with them so many times since 2010. And of course, I mentioned Major League Baseball. We even meet with Council for Responsible Nutrition, for example. But I want to really point out our work with our federal partners. And that is critical in this space. That's our Food and Drug Administration, U.S. Department of Agriculture, the Federal Trade Commission, Department of Justice, Drug Enforcement Administration, and of course, Office of Dietary Supplements and NIH, and they partly fund us for that ingredient database. And our work with all of them is so important because we're all working on facets of this topic. And for us to be able to share information and to go to each other with any questions or information really is been very helpful to us. In fact, prior to COVID, we used to meet in a room with our federal partners just to share the information verbally. And I'd like to actually get back to that. Now we're in this virtual space, but it's critical.
Definitely. And Andrea, it sounds like the recent Performance Enhancing Substances Summit really brought a lot of those stakeholders into the same room to maybe have that discussion face to face. But now that the summit has concluded, what are the next steps for you?
Well, I'm excited to report. I'm not going to give the date, but I'm excited to report that we already scheduled the next Performance Enhancing Substances Summit for next May. And working with Major League Baseball and United States Anti-Doping Agency and others, we're going to be writing a white paper. As I mentioned, we're putting together this PES consortium to really focus on harm reduction from performance-enhancing substances and self-care products. So the purpose will be to protect service members and all athletes from substances and dietary supplements and other products that could result in a positive drug test or a health issue. And in the military, that's a potential readiness issue. So us working with MLB and USADA is huge.
Fantastic. Andrea, can you comment on how Operation Supplement Safety has been working with the Partnership for Clean Competition? And do you have any ideas for how these two organizations could potentially work together on other efforts in the future or going forward?
Well, for sure. You know, it was really great to meet Ryan Murphy in person. This was several months back. We actually met for coffee and had a long conversation. And, you know, it really came about when we at Operation Supplement Safety had started working with Major League Baseball again. And they were the ones who put me in touch with Partnership for Clean Competition. And of course, PCC was involved in the Performance Enhancing Substances Summit that we had May 1st at Major League Baseball headquarters. And of course, Ryan chaired, you know, one of the panels at that summit. And I think moving forward, we are working right now with Major League Baseball and United States Anti-Doping Agency and sort of forming what we're right now calling a consortium. We haven't quite finalized it yet. And we're writing sort of the outline of a white paper. And at that point, when we're finished, we're going to invite other organizations to join our efforts in this consortium. So really starting at that PES summit, and we have the next PES summit scheduled for next May in 2025. So I see Partnership for Clean Competition really being involved as we move forward with this consortium and really drawing attention to this public health issue. And I know the work that you all do, certainly your mission is not only to protect the integrity of sport, but it is also to protect public health. And that's really why we are all joining forces on this topic.
Definitely. I think the PCC is so excited about continuing this partnership with Operation Supplement Safety, and we look forward to some of these things that you mentioned in the future.
It's so important. I know for the PCC that your collaborations are very important, and that, of course, is extremely important to us as well. You know, I'm really excited about working with PCC more because we really haven't had that opportunity in the past.
Definitely. And you mentioned this white paper specifically. I think that is a really important initiative, but maybe thinking more broadly, why is it so important for Operation Supplement Safety to be involved in research that's being conducted in anti-doping and supplement safety?
Well, we must respond to the increased demand signal without compromising quality. And that's really reflected on all parts of our program and activities. And we have to make sure that we're maintaining that prohibited list and have the most recent evidence-based information for all of our educational efforts. So what we do with research helps to ensure we're really providing that evidence-based, up-to-date information. So we conduct research such as systematic reviews to understand the evidence for efficacy, effectiveness, and safety surrounding dietary supplement ingredients, and whether the claims made in the marketplace are then backed by science. And we involve our diverse and expert stakeholders in these activities to ensure that the research is impactful for the end user. We also conduct expert panels. I mentioned that for our ingredient database to, again, bring together diverse experts to look at issues related to appropriateness of use as well as research aspects. What's needed to bridge the gap between research and practice decisions to inform future research direction. And we continually engage in product testing and analysis. And that's really because it's whether or not we're concerned about a particular product, or maybe we need to help raise awareness about something. And we published our recent work on the label accuracy of weight loss products that was actually released May 1st. And that's at JAMA Network Open. And that's getting quite a bit of traction. And again, we do that because we have to.
Absolutely. So if you had to summarize the main findings from this paper that recently came out looking at the accuracy of the labels, what were some of the findings?
Well, we were looking at 12 online companies that were advertising military discounts. 25 had inaccurate labels. And of the 25, 24 had ingredients on the label that were not detected, making them misbranded. 7 had hidden components detected, and 10 had substances on the DoD prohibited list. That really sheds light on what can be lurking in a product. And we have to do that. We're this little program in the DoD, and we continue to utilize resources to do that, to draw attention to it. And I think that really draws attention on the need for only third-party certified products. And particularly when you're talking about consumers such as service members and athletes that are drug tested. So why does MLB promote NSF certified for sport? Or if USADA suggest that their athletes only take products that are NSF certified for sport? And that's a way to mitigate risk. So I think that we have to draw attention that sometimes there are things lurking in a product that you may not know are there.
Definitely. And I'm glad to hear that Operation Supplement Safety is taking an active role in advancing the evidence in this area as well as raising awareness. I think this is absolutely critical. But perhaps we could talk about some of the potential solutions. I think we mentioned a lot of the risks, a lot of the challenges in working in this area of supplement safety. But Andrea, what do you see as some of the most promising potential solutions to maintain the safety, well-being, and performance of athletes and service members in light of some of these risks and challenges?
Education, education, education.
Mm-hmm.
And I always come back to that because there's not many of us doing that education. We know the value of research. We know that. But then how do we take that and put it in understandable formats for our consumers, all of our consumers? That's critical here. And again, that effective partnerships, build on those partnerships, form new partnerships, shed light on what can we do together to then spend some time on maybe some of the other positive stuff. And we want to be in that space, do that research and continue our efforts in educating on using products that have been third-party tested. And I just think when we come back to the average consumer, we all know people that are taking supplements and they're taking multiple supplements. Where are they getting their information? We're up against TikTok. We're up against Instagram. So a lot of times you hear from, I do at least, from people I know, from family, friends, that they just take things because other people tell them to.
Right.
So how do you get that information out there that, okay, you want to take a supplement because you feel that you may need it? And certainly there are value to having people take supplements, but how do you make that informed decision? How do we bring it back to that conversation? And I also want to say that how do we bring it back to what is a dietary supplement? It's supposed to supplement the diet. So let's come back to that. Okay, so you need X, Y, or Z to help supplement your diet. Okay, well, let's help you and make that safe selection. And how do you make that safe selection?
Absolutely. I think those are such important points. And I think for, like you said, the average consumer who's just walking through the grocery store, seeing these supplements right next to the over-the-counter medications that have been rigorously tested and FDA approved, et cetera, they may not even think about the risks and the safety questions involved with them.
And you brought up something really important. Could there be interactions, right? Could there be interactions between what you're taking and a prescription drug? And could there be supplement interactions? And that's why I always say it's important to know what you're consuming. Know, document. I always tell service members, write down when you start a supplement, write down what it is, take a picture of it, how much you're taking. If you're taking multiple supplements, are you also drinking energy drinks? Boy, that's a whole other topic that we can talk about and that we educate on. But it's the cumulative effect. And are you taking prescription drugs? So this is really important. This affects all consumers, not just our service members and athletes, but all consumers who are taking dietary supplements and medications.
Absolutely. Well, I appreciate you bringing up some of these important points and the issues that we're focusing on now. But if we have to shift gears and think about the future, Andrea, what are some of the goals that Operation Supplement Safety is working towards within maybe the next 5 to 10 years?
Well, I mentioned that app, and that's certainly a very important initiative that we hope is out in the marketplace in about a year. But I would say to effectively reach our vast audience and get embedded in the areas that we need to be to ensure the resources are available for all leaders and all service members, all providers, and all health professionals. And we want to be recognized as a sound, evidence-based resource for the informed use of all health, wellness, and performance products. That's a big task. It's actually monumental because there are other obviously important topics that DoD is concerned about. But I always say we have to make sure that our service members only have access to safe supplements. How do we flip this dialogue out here in the industry? Why is it so hard for a service member to make an informed decision? Why is it so challenging? So let's flip that. Let's make it easier. There may be situations where they need certain supplements. So let's not make it so challenging that they have a potential for an adverse event or a positive drug test.
Absolutely. Well, I think those are big picture goals to be working towards. And oftentimes when you have these large goals in mind, there are potential barriers, things like limited resources, time, and just feasibility. So if we took all the barriers away, Andrea, and we gave you all of the resources you could imagine, is there one particular problem in anti-doping science or maybe in supplement safety specifically that you would most want to solve?
I think it's what I just said, that service members would only have access to safe supplements. That includes all products on bases, which is a whole other topic, sold online. We have our service members around the world. So what we have out here now in the industry is some products masquerading as dietary supplements. And they have, quote, research chemical or a materials facts label on a product that has the look and feel of a dietary supplement, but is an ingredient that is an unapproved drug and has no approved use. So if I had all the resources imaginable, that we eliminate those types of products that can really pose harm, and that a service member, an athlete, or an average consumer can't distinguish maybe between that and a legitimate dietary supplement. I think service members, athletes, and consumers are very savvy as well. However, there's so much coming at all of us from all these different directions. As I mentioned, from these platforms and this, as our paper pointed out, offering discounts. So if we can flip that they have access to only safe supplements means, wow, we've really done something.
Absolutely. I think that it would be a wonderful state for us to be in for, like you said, service members as well as athletes and the general public. And I know we covered a lot of topics in our conversation today. If you've piqued the interest of our listeners and they would like to learn more, Andrea, what is the best way for them to do so?
I would say visit ops.org at opss.org. And on social media, we have Facebook, Instagram, Twitter, YouTube. We have a little, we're working on that. And to reach in if they need to. We have that IC Expert portal if they want to collaborate, or again, they might want to see something if they're a provider or an educator that they think might be useful in this space. We're all ears.
I love it. Well, listeners, definitely check out these resources. And Andrea, thank you so much for joining us on the show today. It's been wonderful to learn more about you and your work.
Thank you. I really appreciate, again, the opportunity to talk with you today.
Well, it's been great to learn more. And listeners, we hope you take a moment to learn more as well. And we appreciate you joining us in this podcast episode. Please take a moment, if you can, to rate and leave a review on your favorite podcast platform. And listeners, please note that the Anti-Doping Podcast features a wide variety of clean sport experts, and episodes may include statements and or viewpoints that do not necessarily reflect the views or values of the PCC. Thank you, and we look forward to seeing you on the next episode of the Anti-Doping Podcast.